But I also just want to emphasize resilience. This is something that I did not at all think about after 9/11. Only in the last few years have I thought more about what helps people to be strong and adapt and bounce back. But these are, different resilience factors. And I, mention it. I've had a chance to do. We develop resilience workshops, and I've had a chance to do some of them or model them for groups of psychologists in Israel, but also be thinking about promoting strengths. And these are 10 different resilience factors that are based on research that one can promote. And I have to say, we didn't do any of that in the 9/11 program. We were all about finding mental health problems and not promoting resilience. And I think, I mean, obviously we did a lot of good, but if I could do it again, I would incorporate a lot more about resilience, and perhaps the resilience workshops that we developed for the pandemic, I would use with the workers. Um, okay, I already said this. I
Bring
mean,
it, you're not a baby.
You're ADHD, so that baby, because then you're a stupid
I
baby.
okay. So, I mean, this may be pretty obvious, but if you're doing mental health work, the idea of vicarious trauma is, you get exposed to a lot. It's, you hear a lot and you become a container for a lot of stuff. So ideally you set up something for your staff to support them, and we've done various things over the years. Although a colleague of mine also talks about vicarious resilience, right? Being inspired by the stories that you hear and the strength that people showed, even in the face of October 7th. And I already said this idea of build back better, right? We've certainly been able to do that for all these different labor unions here in New York and for our firefighters through our program. Yes, and this is just another example of that, to the idea of building back better. Japan, before the 3/11 disaster in 2011, had a psychiatric system that was very much about inpatient psychiatric care, long-term inpatient care, not community-based at all, not outpatient-based at all, but in part because a number of psychiatric hospitals were damaged in the earthquake or off limits because of the radiation exposure. They actually kind of had to do something different. And they wound up opening up all these outpatient mental health centers, which we generally think of as a good thing, right? And don't have people locked up in hospitals. So this is just another example. That's an example of sort of using a bad event like October 7th to make things better than they were before. Just to comment on a few of what I would call mischances. What concerned me most was actually who wasn't coming to our program, right? You always worry about who's not showing up. Are you missing the most affected, right? If somebody has PTSD and they're super avoidant, maybe they're not going to take the subway up to Mount Sinai. I had at the time wanted to get a mobile van and drive around to people's homes for people that weren't showing up, but we didn't have the funding for that. And we're not so good at thinking outside the box sometimes. But what's different now is because at the time, right, we had the wheel, we had fire, but we did not have like smartphones and telepsychiatry. We have that now, and I've been really impressed by how many different app developers in Israel are trying to develop things, apps, etc., to be able to treat people. And obviously, plant therapy is also about telepsychiatry, right? And that's not something we had after 9/11. So, it's just such a great opportunity to reach people from far away that we did not have. Another concern I had at the time, which I was never able to address, which is you had this population that is now, many of whom were not able to work because of disability related to the trauma, physical or mental health. And we were giving them antidepressants and psychotherapy. And yes, we were giving them some government benefits. But, work is about, income, but it's also about purpose and meaning. And, what I wish we had done is have occupational rehab programs. Now, I was at Ichilov and I saw that there, saw them with some rehab programs there. But what I had wanted to do was really have like a full-blown vocational retraining program for people, and I would think that this will be relevant, particularly for, as and alluded to earlier, for injured and potentially disabled soldiers coming back. And I had wanted to. I don't know if you've heard of Habitat for Humanity, but it's a group that goes and builds homes for people, and you volunteer. You get a bunch of volunteers together. You build homes. I wanted to take a bunch of our guys, many of whom were used to working with their hands, and go build houses for people with Habitat for Humanity. But it turns out if you do it as a group, you actually have to pay, and I couldn't raise money for that. The other, I think, mischance that we had that I have talked with colleagues in Israel about around October 7th is what's called task shifting, which is training non-mental health professionals to provide mental health care. There's a sizable literature that you can teach people with a high school education how to do cognitive behavioral therapy and get excellent outcomes. And CBT, for example, being very evidence-based, very effective for a lot of trauma-related conditions. You can therefore use non-health professionals and expand your workforce. Now, I understand that there's been quite a debate about this and some of the media in Israel about this, that and maybe some territoriality around sort of taking work away from mental health professionals, but doesn't seem like there are enough. And so even here at Mount Sinai, in New York, right, we have 2,000 plus just psychiatrists alone. We have a lot of mental health professionals, but we still don't have enough. So I run a program where we teach our medical students, who admittedly are fairly educated, far more than high school, but our medical students, we teach them how to provide psychotherapy to uninsured people, right? We have a lack of insurance issue here in the States, to uninsured recent migrants here in our neighborhood with excellent outcomes. And, I think we actually could have made a bigger impact after 9/11 if we had gone down that route. And maybe that's something to consider for, expanding, reaching people after October 7th, So just to say, I mean, I've been consulted by many Israeli mental health professionals about what to do. I think, I just think, my message is, it seems to me you have the skills. It's just an overwhelming event. It's, you're personally affected, et cetera, and maybe in different ways. But, you have the skills and the will. So I'm a big believer that you will rise to the occasion. I have been impressed that the Israeli government, I guess, as I said earlier, has been quite attuned to the need to address mental health, seemed to me from very, very early on. And I give them a lot of credit. I gather the reality of translating that will into something concrete is still slow to happen. But I think there's definitely a seed of desire there that I have to say took years here in New York to get our government to get with the program about 9/11 responders' mental health needs. And I think, NGOs and nonprofits, I'm so impressed by how many people want to do something in Israel. Just like Planet Therapy, just how many people want to start a nonprofit, create an app. I saw nothing, I mean, a little bit like that, and I don't want to say we didn't have that here in New York, but that sort of can do, let's build something and make this work spirit seems very Israeli to me, from what I can tell, and not quite as New York. New York has got its own kind of energy, but I've been so impressed. I was actually just meeting with someone earlier today who's got an app about using guided imagery, and it's so impressive. So I think Israel really has that going for it, separate from the government, separate from the skills and the will of the mental health professionals, is just the level of desire for innovation and building things from scratch. I think is going to serve Israel really well post October 7th. Okay, that's my talk. Happy to stop screen sharing. And I don't know if people have comments or questions. Happy to try to take them.
Craig, thank you. Before anybody asks question, that was amazing. Thank you so much.
Sure.
I want to hear first what people say, please don't be shy. Use this opportunity. Batchen, yeah, you can speak.
Hi, thank you very much. There is something you said that really made a lot of sense to me with the clients that I've met, through planetherapy. And it's about how, I think most of them, 3 out of 4, said it's not exactly the war or the attack or something like that, but suddenly everything comes up. Yeah, so my son is now in Gaza, but actually I can't sleep because of something else I had. And that line between, we want to make sure that we give our service to who needs it, but how do you know, first of all, if we are the right answer for them, and B, what do you if you focus during the therapy sessions on the reason, or the origin, especially when you don't have a lot of time with them.
Well, I mean, I'm of the feeling that as long as you've got somebody in the seat talking to you, you're going to be doing good. And in other words, the mere fact that they've sought you out and that you are trying, right? I mean, there's a lot of literature that says it's the process of being listened to, of someone who's trying to help you, and less the technique and the focus that makes a lot of difference. But so I'm not trying to like minimize CBT or psychodynamic psychotherapy, but and I also think I do think we get into it's as I think my talk may have suggested, it gets fuzzy over time, like what was related to 9/11 versus what's related to life. And I just think if you see this as opportunity to improve people's mental health and not parse out, is it October 7th? Is it not? As long as you're helping them in some way, I think that that's all that matters. And I get a little concerned that like government funding gets tied to, they have to have PTSD, they have to be certified like in our program. I mean, I think that that's quite unfortunate. If this pushes people into mental health care, who cares why? That's my feeling. But so.
Okay, yeah, thank you.
Okay.
I was very interested in your attempts to try and raise money for your programs, the funding, your grants, in terms of the things that you emphasized to try and get funding, the methods that you're using, or really kind of the problems underlying why you're seeking the funding. I mean, maybe it varies, situation to situation or foundation to foundation. But I was very interested in your areas of emphasis, trying to convince people to give you money.
Yeah, I mean, we were quite fortunate at the Robin Hood Foundation. They're called the Robin Hood Foundation because it's a bunch of like hedge fund investors who sort of, the idea is they take from the rich and they give to the poor. So they really are very much emphasize the underserved. And I happen to be introduced to them. I mean, this is just, I admit, I think an element of luck. Someone I knew somebody there, introduced me to them. And then when we heard about all these workers that were coming to our medical center, I said, I think that's an underserved population, and they agreed, and so it happened to be a meeting of minds.
Gotcha.
Yeah.
I have a question. I think we're dealing here in Israel with a collective trauma. It's not only, the soldiers and their families, and not only the people that were evacuated. It's the whole country, especially because of the hostages, but everything else. And how would you approach that? How can you kind of treat the whole country? How would you
Well,
approach that? I've been
well,
thinking a lot about it, and I have some thoughts, but I wonder how you would look at it.
well, I'd be interested in your thoughts, but well, that's where the military has this idea of battle buddies, right? And I think having a I know maybe it sounds too idealistic or too, I don't know, too weird, but I think if you create a program where you have people pair off and check in with one another, not in the same family, but even in a community, a buddy system, you know, it, I think I think even just trying to set up that program, I think in and of itself will I think temper some of the collective trauma, but then obviously letting it run, having people check in with one another. I know people naturally do that, but actually sort of formalizing it a little bit. I mean, to my knowledge, this has never been done, but that was the idea I suggested early on, as a way to address that. So, yeah.
Can you elaborate a bit more about the program that you mentioned about non-professional volunteers, the training that you mentioned? How the government looked at that? What were the challenges that you were facing? Things
Well,
of that nature.
Well, we did not do that for 9/11, and I think had we tried, we probably would have run into some politics. Like, how can you let a bunch of high school students treat these 9/11 heroes, right? I think there would have been problems, but we've done it in other settings, and it's been done around the world in low and middle income countries. And I know we can say, well, Israel's it's Israel or it's the United States. How can you do that? But there's a lot of literature to say it works perfectly well, perfectly well. And the World Health Organization has these pyramids that describe how at the base of the pyramid you have what they call non-specialist care or non-specialist support or peer-based care. So there's like lots of policy and lots of evidence to support it. I think it can be a somewhat hard sell, but I think if you show people the data, and there's plenty of papers on it, it might be an easier sell.
I think with what we said earlier about buddies, I think it's a great program just because, having a buddy check on you, even through schools. I work through crisis text line in the United States, and I see a lot of problems in schools. And if we would implement a mental health class that is mandatory to everybody, I think the situation will change throughout the world, not just in particular in Israel. And I think Israel must have that as, Bible study or mental health study and math studies. So I think that's, the opportunity to start something like that in school and implement, basic counseling and basic courses for each other to really, be aware of your surrounding and what's the condition of your friends, and approach him to help, and not, it will lower bullying and other issues that they have now in schools. And I see that all over. And it's on the rise. All those problems are on the rise everywhere I see. So maybe that's the way.
I appreciate what you had to say. Yeah, no, I think it can help create a more of a mentally healthy culture and more accepting of it. And it just speaks to the idea of social support being like one of the best ways for people to get through a trauma, is just good, caring support that doesn't have to come from a highly technical or paid professional.
Right. Thank you for that. I think that's very important. And even reaching, different podcasts and things like that encourage self-help will be great for everybody in Israel and all over.
Absolutely. Yeah, thank you for your comments.
Thank you.
I would also like to ask a question.
Please.
Yes, I'm working with high schools in the north of Israel. One is evacuated, and the other is really in a horrible condition of missiles every day. And regarding your program of buddies or task shifting, doing mental health work of non-professionals, if you can say something about how can it work in schools, because it seems like quite suitable.
Well, I think we actually, I'm aware of a peer program that was developed actually in rural Alaska, right, where there are very few services, and they developed they had like a big, I think, drug program. So they set up this sort of peer system, and they had like peer leaders, not just like a buddy system, but like peer leaders, and then you could build into a buddy system. And we did this down actually at a orphanage in Central America, in Belize, where we work. So I think there's definitely a framework for setting up something and doing as the I forget the prior speaker's name, but as you suggested, just some basic teaching. About mental health and how to provide support and how to just listen. A lot of it is just listening, I think. And I think it would be particularly good for kids to give them a role, right? To give them something active so that they could be helping and not just be passive recipients of help or feeling helpless. So I think it has a lot to recommend itself. And somewhere I have what we did down in Belize, or I have the literature from rural Alaska, but I don't think it's that. I think the concepts itself are not too challenging. I think it's just a matter of organizing it. I think, it's the coordination and putting it together and having the will to do it, I think.
Thank you.
Yeah, and if you want that information, Tal and Alana have my contact information. I'd be happy to send it to you.
That would be amazing.
Yeah.
Anybody else want to ask questions before we? No. Yeah.
I just wanna,
Yes,
I wanna ask something.
please.
I'm from Mexico City, so I've worked in 2017 in the earthquake, after the earthquake, and also recently last year with the hurricane in Acapulco. But the difference, the big, huge difference that I feel now with people in Israel is that the stress and the trauma is still going on. It's not, as you said, it's not like 9/11, that it was thankfully only one event. And for me, it's hard to how to manage the comforting people in saying, okay, but this is it happened, but it's over now.
Yeah, that's where I think the resilience framework is very helpful. I mean, in terms of talking about how one can adapt even while there's an ongoing trauma. I just think it gives you a useful language and a framework for doing it that isn't, talking, and it's because I think some of what you're referring to isn't, people are all running around with PTSD. They're just, people are stressed and distressed, right? And so coming in at the level of resilience, and and we have these resilience workshops where we focus on how to be realistically optimistic even when things are bad, right? Or how to think of it spiritually or how to face fears without being overwhelmed by them. I think coming at that level is a really, in my experience, a very good way to deal with an ongoing trauma without thinking about psychiatric diagnoses.
Thank you.
Yeah, and I'm happy that I can. Yeah, if you want more information on that, I'd be happy to tell you more about that if you want to get in touch. So
yes, I would love to. Thank you.
Yeah,
yes.
Sure.
I was going to say something before we. I don't know if there's any more questions, but yesterday Tal and I gave our first open audience lecture, and it was to the elderly in Israel. And what I found that, first of all, there's not enough help for them and they're alone. There were people all the way from the north and people all the way from the south. And some people don't even have a bomb shelter, so they don't have enough time to run. It's a matter of if they're lucky or not. And so I said, I was trying to say, like what you're saying about resilience. And I said, are there any therapists among you? And they said, oh, actually, I am this and I am that. And I said, well, great. Do you want to join us? Would you like to give 2 hours to speak to somebody and just listen and give? Because then it hit me. We're talking about young people to train them quickly, but we have so many elderly people that are already fully trained. And not only that they're trained, trauma-wise, they are the first generation of the Holocaust.
Mm-hmm.
So why not use that? So
Yeah.
that was like that.
I think that I thought along the same lines. Like I at one point tried to write a grant, wasn't funded, but to use recently retired mental health professionals to do this, to go to low resource settings and provide mental health care. Right, they're retired, they're looking for something else. They have all the experience and the wisdom, and they can mentor younger people. So I'm totally on board with that.
Okay, so we need just the funding. We need to work on that because
Yes.
there's
Yeah,
so many ideas. And
yeah.
I have to tell you, the smiles and the warmth you could feel. The first, in the beginning of the lecture, they were looking like, who is these two? Oh, there's two, there's not just one. And then all of a sudden it turned into a very warm lecture and very warm conversation. So yeah, we're gonna look how we can push it forward and get them more involved from Israel. Definitely. Thank you so much,
Yes.
Greg.
Yeah, no, I completely agree with you.
Yeah. Anybody else want to ask questions before we close? No? So if there's anybody out there who is not part of our volunteers, which we also try and make sure that we keep giving to our volunteers ways of education, more lectures, more resources. We're working on it also to give a resilience seminar through a body called Natal in Israel. And so we're open, Craig, if you have any workshops to give our therapists, that would be amazing.
We have them.
Of course, that would be great, especially with all your experience. And if there's anybody out there who is not a therapist but would like to contribute, we left in the chat 100 messages of the link to the website. We're looking for people. Basically, Tal and I described it, that we're running a marathon in the dark. And if people are holding the light and want to run with us, you're more than welcome. If not, we keep running. We won't stop. We're here and we're here to stay. So.
Yeah, and all that passion and intention, I have no doubt will carry you forward. And I hope that you get the volunteers and some of the funding to match your ambition, which is very impressive. So.
Thanks. So thank you everybody for joining us.